There we go. All right, Jordan, the microphone is yours.
Thank you, Kathy. Everyone, good afternoon and welcome to our immunizations webinar. Today we will give you a little bit of insight into our immunizations team and the work that they do here at the organization. You can go to the next slide. Okay, thank you. So the term EverThrive Illinois supports access to quality healthcare and provides resources to achieve health equity. And this time, our focus has broadened from coverage for pregnant people to addressing a wide range of factors that can impact the health of parents, children, and overall communities, including the lack of access to quality healthcare, lack of resources, and biases within the healthcare system that can affect the lives of patients and create mistrust. Next slide. The term The term reproductive justice was created in 1994 by 4 Black women who met in Chicago, who saw the need to advocate for marginalized individuals and communities. Reproductive justice is defined as the human right to maintain personal bodily autonomy, have children, not have children, and parent the children in safe and sustainable communities. EverThrive Illinois strives to affirm and center the experiences and voices of communities most impacted by injustice to achieve reproductive justice for all people and families, especially those in Black, Brown, Indigenous, and LGBTQIA+ communities. We ensure that they have the access, resources, and healthcare necessary to create and sustain families on their own terms. So our mission is to achieve reproductive justice in the healthcare ecosystem through community-driven partnership, policy action, and system change. Our vision is a just and affirming healthcare ecosystem where individuals, families, and communities can thrive. Our values, we live our values both within our organization and in the work that we do. So reproductive justice is something that I just talked about. We want everyone to have the right to bodily autonomy. And if they choose to be a parent, they have the right to raise their families in safe and healthy communities. Our anti-racism value, create a safe environment and advocate against biases and judgment that are based on the color of someone's skin and what they look like, and shouldn't impact whether or not they have access to quality healthcare and resources that can help them. Centering the most impacted, so advocating for communities and going into these communities to disseminate information and resources through things like outreach and events that we host, like our annual community baby shower. We listen to the needs of people in communities and apply it to our work through things like listening sessions and focus groups, and working with community leaders to ensure that people are getting these resources. And then bold action and transformation. We create campaigns, we do policy work that could actually navigate change within the healthcare space in Illinois. Our strategic priorities, so achieving birth equity, we believe that every birthing person should be able to receive the right care before, after, and during pregnancy. Increasing vaccine confidence, so we want people to have the necessary information to feel empowered to take action about their health, which is pretty much what our webinar is about today. And you'll hear more about it pretty soon. Expanding access to comprehensive healthcare and living by our values. All right, so now we're going to switch to our immunization team that we have here with us today to discuss the work that they do in increasing vaccine confidence. We have Ceci Tipiani Fuentes, who is our Associate Director of Immunizations, and we also have Arias Benitez Perez, who is our Immunization Manager. So I'll pass on the floor to them.
Thank you, Jordan, and thank you everyone for joining in. Good afternoon. As Jordan said, my name is Ceci. I am the Associate Director of our immunization programs, and we're really excited to share some of the work that we've been doing here in immunizations, particularly our campaigns, which we'll dive right into. Next slide, Jordan. Thank you. So as Jordan mentioned, one of our strategic priorities for EverThrive Illinois is really around increasing vaccine confidence. It is a top priority for us. We provide community-centered education to address the root causes of vaccine reluctance, including systemic racism within the healthcare system that breeds mistrust. And this is something that for over 20 years, EverThrive Illinois has been leading community organization, coordinating vaccine promotion, outreach, directly addressing the root causes of vaccine hesitancy, and really advancing policies and system change that make vaccines more accessible to all Illinois. Really, to achieve this goal, we utilize a few strategies that we'll discuss today, which complement and strengthen one another. So we have here our coalition building. We build coalition with public health officials, healthcare providers, social service providers, community leaders to really address hyperlocal barriers to vaccination. We know that that's key. Digital education, that's another component of our campaign building. Over the last couple of years, we've really centered our efforts on being active in the social media space. As we know, it's a primary source of information for folks. And we facilitate digital education campaigns really based on a tone of using compassion and understanding to meet people where they are at and help them make better informed decisions to support their health and the health of their families. Particularly, we know, the period of COVID and the pandemic, that tone was really important to ensuring that we were providing information for folks and it was resonating in a way that they were accepting of the information. And lastly, our community outreach. We have a great community outreach workforce team. We're able to conduct community outreach to connect people. We're able to do one-on-one community outreach in the communities most impacted by vaccine preventable diseases. And now I'll pass it over to Arias for a little bit more about some of those strategies and the overall impact as it relates to us increasing vaccine confidence.
Thank you, Ceci. And I'm sorry for having to cut my camera. For some reason, you were glitching on my end. So if at any point you all can't hear me, please just let me know. It might just be a Wi-Fi issue. But my name is Arias Benitez Perez. I am the Immunization Equity Manager here at EverThrive. And I'm mainly going to talk about our coalition building aspect to our immunizations program. Like Ceci was saying, coalition building is a main component to all of our immunizations programming and is truly instrumental in forming all of our campaigns. So a great example of how we use coalition building to promote vaccination in partnership with communities are our Equitable Vaccine Advisory Council, or our EVACs. The EVACs are advisory groups comprised of key community members and stakeholders collaborating to identify and address facilitators and barriers to vaccination uptake. Currently, we actually facilitate 2 EVACs, one in the Chicago area and one in Western Cook County. And the EVACs have 3 primary goals. First and foremost, they are a space about building partnerships and resource sharing. Multiple times, systems of care can be siloed, and it can be difficult to engage partners outside of the healthcare system, even though they are often our most influential messengers, which we learned mainly during the COVID-19 pandemic. And so really, it is about bringing groups together around the shared goal, which allows us to align our work and gain a more comprehensive understanding of hyperlocal context, as well as identify and share best practices and resources in a constantly changing landscape. Like Ceci was saying, we bring multiple different stakeholders to the table, not only people who are working within healthcare systems, but also community-based organizations who might be the point people for community members and community members themselves who share their lived experiences. Second of all, the EVACs are instrumental when refining immunization and healthcare messaging. We are all knowing that there is a lot of public health education and health information in front of individuals and families every single day, which can leave people feeling overwhelmed and confused about how they can best protect themselves and their families. And so EverThrive Illinois and the EVACs work together to develop that messaging that directly addresses community needs and cuts through some of the noise to meet people where they are. And a great example of how we're doing just that is mainly just hosting community assessments events in the community this spring. We gather information from community residents that will inform our community-facing educational resources. And so definitely involving EVACs, feedback and just expertise has been crucial in building those materials. And then finally, the EVACs allow us to identify and elevate hyperlocal barriers and facilitators to vaccination and accessing healthcare overall. So we all know that people's experiences differ greatly by where they live, what their background is, what their current situation is, etc. But a lot of the strategies that have been used in public health traditionally mainly assume people's experiences are relatively similar based on maybe one or two demographic factors. And what the EVAC really does is they're committed to acknowledging the importance of understanding and working within hyperlocal context. Each community has unique barriers to care as well as unique facilitators that we really focus in on, and we collect community-specific feedback and priorities to work and build on those specifically. And it definitely does result in having more effective campaigns, materials, and you'll be able to see some of that a little bit later. Next slide. Thank you. And then here we just have a EVAC member spotlight. This is Diego. Diego is an active member of EVAC since its inception in 2022. He is a community organizer with the Gage Park Latinx Council and is a co-founder of the Chicago Student Pandemic Response. And he really highlights the importance of continuing to create spaces to share experiences, barriers, and best practices to ensure that community members are continuously supported, heard, and provided with opportunities for accessible health education. And I believe his testimonial is available on our annual report, which is on our website as well, if you want to read a little bit more of what he says about his personal experience working within our EVAC councils. Next slide. I'll pass it back to Ceci.
And Arias has really been instrumental, for those of you on the call, in leading this work and really establishing trust within those EVAC coalitions. So I'm really grateful to have Arias part of the team because we understand the importance of working within community and communities. Sometimes that can be difficult, establishing the trust. And I think that's one of the pillars that we really value is being able to be trustworthy partners. As it relates to our digital education campaigns, here's an example of one of the campaigns that we're actually going to be launching in a few days. It's related to our National Infant Immunization Week campaign. And our community education campaigns are really an essential part of how we increase vaccine confidence and provide and vaccine resources. Our campaigns typically have two components. One is our community-centered, culturally relevant education resources, such as fact sheets that we'll create for particular audiences, maybe parents and caregivers, etc. And we use our outreach workforce team to distribute these resources within the communities that we serve. And the second component is our digital campaign. As I mentioned earlier, we know social media is a very prominent way in which individuals mind. We use our website and digital advertising to promote vaccine information, dispel myths, and share our resources and other resource links. And really by coupling these allows us to blanket communities with consistent messaging and increase the likelihood that people see, read, and digest really what we're offering, hopefully leading them to make the choice to vaccinate, but at the very least providing them with factual, accurate information for them to make decisions for themselves and their families. Over the last few years, we have launched several digital campaigns, such as our flu promotion for parents, caregivers. We've done lots of COVID-19 web pages and revisions over the years. As many of you know, there's been changes within the COVID-19 landscape. So we've made sure that our webpage remain current. We've had a campaign related to adolescent vaccination, both available for parents as well as adolescents. And these campaigns have been extremely effective as part of our larger strategy to blanket these communities with this information and resources so that they can make choices about vaccination. And through these campaigns, we're able to see our reach, our engagement through some of the metric reports that we are able to obtain. For example, last year's flu promotion campaign received 5.6 million impressions online in just 4 months. So, we feel proud that our campaigns are really reaching our target audience. Our campaign development aligns with emerging vaccine trends while also ensuring we address hyperlocal vaccination myths and barriers. And we really leverage not only community input, but our partners and different sources such as our outreach workforce. We've done focus groups to gather information and really taken that information and applied it into our campaign and our resources, ensuring that really our campaign and our resources reflect culturally and linguistically relevant vaccine information. And through the use of our social media and our outreach team, we've been able to disseminate these resources to the communities most impacted. Next slide. Here we have our outreach workforce, which, as I mentioned, a critical element of our campaign. Our team currently consists of 7 outreach workers who canvass priority communities to distribute vaccine education. They work on dispelling myths, they answer community questions, and they really connect people to vaccine resources that otherwise they might not have received or find accessible. And in this last year, we've been able to connect one-on-one with more than 20,000 people through our canvassing and participants like health fairs. Our outreach workers are BIPOC folks, really reflective of our priority communities. And we really know the importance of that is allowing them to be viewed as trusted messengers in the communities that they serve. And as part of their training, we provide onboarding education for each outreach worker to understand how to best deliver information, what strategies would resonate best within those respective communities, and how to confidently promote vaccine confidence while they're conducting community and street outreach. Next slide. And that I'll hand back over to Arias.
Thank you. And I'm going to try to cut my camera on. Hopefully I don't start glitching. But I know that there are tons of things that are happening in the immunization side. And so I just want to share a little bit of, the amazing things that we have coming up. So first and foremost, EVAC continues. We are expanding, especially our West Cook EVAC to include representation from Broadview. Currently, we are working within the areas of Melrose Park, Maywood, Bellwood, and now Broadview. And so we are looking to recruit a couple of other folks really to continue creating those spaces for stakeholders to share those hyperlocal perspectives. Just like every single neighborhood in Chicago is different, every single village and township is different, and they all have different needs and populations. And so we really want to bring all those voices to the table and be able to create and share resources. So we definitely are excited to continue working with some great partners in the area on the EVAC side. We will also be expanding our outreach. We will be adding a Latinx/bilingual Spanish outreach worker to our workforce, mainly again to ensure that materials are community centered, that we're meeting community members where they are, and ensuring that all of our activities and programs are accessible for folks. We really want people to use all of these resources or see us as a trusted source for information. And we know that one of the main ways that we can do that is by meeting people where they are and being accessible for folks. And I know Ceci was talking about our upcoming NIW campaign. National Infant Immunization Week is next month in April. It is from April 22nd to 29th. And so we have tons and tons of stuff planned for that campaign. Our main target for that campaign are BIPOC, Black, Indigenous, people of color, parents, caregivers, and pregnant individuals. And we are creating palm cards, outreach materials, tangible outreach materials with key messages for folks, as well as updating some of our landing pages, which is full of resources for community members to find answers to their questions. Again, we really want to ensure that community members feel comfortable engaging in dialogue and with their providers and asking those questions with every person that they see, because again, we believe that they have the right to ask questions. They have the right to ask any and all of the questions until they find the answers that they need to make the best decision for themselves and for their family. And so we are definitely very excited to share more of that in the coming weeks. Next slide.
Thank you, Arias. And actually, before we move on to the closing slides, we do have a question in the chat I wanted to pose to you guys. So somebody asked, sort of as we were moving from digital education to community outreach, how many shots were given? So I wonder if you, one of you could talk about sort of the fact that we don't provide shots, spoiler question to that answer to that question, and how our work results in, we believe, an increased vaccination rate.
Definitely, yeah. So we are, as Kathy said, we are not a direct provider in the sense that we are able to offer vaccines. But what we are able to do is redirect folks to where they can access vaccines within their respective communities. Sometimes that's their local CDPH clinic, um, other FQHCs. So as part of our resources, both on our webpage and community facing resources, we are able to provide information for folks so where they can go to get, whether it's the flu vaccine, the COVID vaccine, whatever it may be. There's several resources available for them to identify where they can get a vaccine. And our hope is that they're able to then, by redirecting and hopefully connecting them to a vaccine within their local community, it makes it more accessible. We know, access is a key pivotal point of vaccination. And so within being able to get those within your respective community is key. We
Thank
do
you.
not follow up with them in regards to see if they got the vaccine. Unfortunately, we don't have the capacity at this time. You were just able to sometimes get some feedback from outreach workers who circulate those particular same communities, and they're able to sometimes get some of that feedback.
I'll add, we have also done sort of informal evaluation of some of our campaigns by having kind of short surveys that pop up when people come to the website. And what we've learned from that is that people are generally reporting that they're finding answers to the questions that we need, which we know is an important part of making the choice to vaccinate. And that some people are reporting that this is helping them feel more comfortable in that choice. We also partner extremely closely with the Chicago Department of Public Health and the Illinois Department of Public Health. And so we're tracking overall vaccination rates. With them, we're looking at specific communities in partnership with those agencies that are able to track the larger public health data. And a lot of our work is being focused on those communities where we're finding the greatest challenges in increasing vaccination rate or some of the bigger barriers. So we don't necessarily see a one-to-one, but we know that a one-to-one of we did outreach and therefore people became vaccinated, but we know that these are areas where having trusted community messengers and considerable effort put into outreach and education is beneficial. Okay. Just a reminder, if you have any questions, please put them in the chat. We're going to move on to just the last few slides.
Thank you for that, Kathy, and thank you to Ceci and Arias for giving all that great information, and the work that you guys do was extremely important. But this is basically our immunizations team, so you guys pretty much already met Ceci and Arias, and we also want to acknowledge Elena Mandarino. I hope I said her last name right, but she's the public health associate through the CDC. And if you guys want to stay connected with us, you can sign up for email updates on our program's accomplishments. You can join our Policy Action Network and get involved with the policy work that we do, that we're currently doing and hopefully doing more of in the future as well. And you can also register for upcoming events that we have. So you can scan the QR code or visit our website, which is everthriveio.org. You can also visit our publications and resources page, which is also on our website. Basically, this page has links to our vaccination campaigns, campaigns that we've done focusing on COVID-19, the flu, and we also have campaigns on there for care for or resources for birthing and pregnant people. So again, you can scan the QR code in the orange box, or you can go to the website link that's also in the orange box at the bottom. Yeah, so thank you, everyone. Kathy, I don't know if you wanted to sort of give out your information.
Yeah, so hi, I've been your technical person, but I'm also the Deputy Director of External Affairs here at EverThrive. I so appreciate everybody's time. Thank you to Jordan, Ceci, and Arias for making this happen. And also shout out to Elena and Deanna who support this work. If you have any other questions, or if you ever want to connect to learn more about EverThrive's work and our immunizations work, I'm happy to be the person you find, and my email is on this page. If I'm not seeing any further questions, so we'll go ahead and wrap up today's presentation. Thank you so much for joining us to learn a little bit more about our immunizations work at EverThrive. And we hope to, we have a question from Chris, working with behavioral health providers. This looks like one that would be great for us to follow up with you on specifically offline. So I'll shoot you an email in just a few minutes. All right. Thank you, everyone, and have a good day.
You have a good one.
Thanks, everyone. Have a good rest of the day.